You know, over the past several years, we've been visiting with Dr. Sonia Spencer, talking about a lot of the different things that she treats as a chiropractor, and you'd be surprised the relief that you can get for headaches, migraines. I mean, you got a list of things here. How are you doing? Good to see you.
I'm doing awesome, Jim. It's so good to see you too. The reason why I made this list is for our current patients and patients that they want to refer, to let them know all the things we do treat, because many times their friends and family are suffering needlessly because they don't know all the different things that chiropractic can help them with. True story, one of my patients came in and he said, "I'm sorry I missed my appointment on Monday. I was taking my wife to the hospital. She has migraine headaches." He had been a patient of mine for so long, he didn't even know that we treated migraines and headaches. And so with this poster that I put together, we're able to just tell everybody all the things that we can treat naturally without drugs or surgery, very safely with chiropractic care. Most people don't realize that chiropractic is the safest form of treatment that there is. It's safer than taking an aspirin. And I don't know how many people do that many times a day. Mm-hmm. But you know, the United States consumes 80% of all the prescription drugs in the world. And of course, we have an opioid epidemic here with people trying to treat pain through medications. We have a high rate of surgery, and surgeries are failing. So chiropractic care is a natural alternative to help people treat these conditions without those drugs, without that surgery, in a safe, effective manner. So the things that we treat here, Jim, are of course headaches and migraines. I had a patient come in for back pain a couple of weeks ago, Jim. Well, actually, it's been a month ago now. And she listed on her form that she had migraines. And she said, I talked to her about the migraines, and she said, well, I'm here for my back, but I want to see if it'll help with my migraines. Now, she was having headaches every single day and migraines 3 and 4 times per month. And so we started treating her for her back, and as a side, we were taking care of her neck for her migraines. She has not had a single headache since she started treatment.
Wow.
And this lady had headaches all the time and for years. Of course, neck pain and stiffness, everybody knows that chiropractic treats that, right? You know.
And know very well.
You do. And if you have the neck pain and stiffness, it can cause numbness and tingling to go down into your arms, because
it affects the nerves.
Those delicate nerves get pinched. And it causes a variety of symptoms. Sometimes people, you know, have come in here, they have ruled out heart attack, heart problems, all sorts of things for their neck, and many times people are recommended surgery for this, and we can help them with chiropractic care, and they don't want to have the surgery. This is a great place to come. You know what they say about if you go into a barber shop, you're going to get a haircut, right?
Right.
So be careful about going to the surgeon's office.
Something's going to get cut.
All right. So, of course, shoulder pain out into the shoulder. We treat shoulder injuries, rotator cuff tears, non-invasively. We do rehab here, and, of course, chiropractic adjustments when indicated.
So I'm sure you see a lot of people that are involved in sports.
Absolutely.
Coming here with those kind of rotator cuffs or neck or whatever. I mean, they can, the long list here that they can be involved with.
Long list, and the people reaching into the back seat chronically to get things and pulling them, they injure their shoulders that way. Reaching overhead, putting boxes up. People injure their shoulders in all different ways. Of course, we talk about carpal tunnel here all the time.
Right.
And, you know, chiropractic is very effective in treating that, because we check where the nerve starts all the way down to it goes into the fingers. And we have great success in treating carpal tunnel, even on failed surgery cases. So we invite you to come in and talk to me about that. Back pain, everybody knows that chiropractic treats back pain, but a lot of people say, well, you know, my back can't be adjusted because I've had a surgery, or my back can't be adjusted because I have arthritis. That is just totally not true. We are very skilled at working with people who have surgery. In fact, one of my patients has had 7 spinal surgeries.
Wow.
Yeah. And so people have nowhere to go once they've done all that, and you know, they don't want to take the pain give many times we can work above and below that surgical area to help people who have just
give them some relief,
and they've just been putting up with that chronic debilitating pain from a failed surgery because they don't know that they can see a chiropractor. Also, chiropractic is a great part of a person's care who has fibromyalgia. Now that's a very complex problem that often
A lot of people suffer from that.
Yes, but gentle, effective chiropractic care relieves stress off the joints and in turn can help the muscles relax. And you know, a person in fibromyalgia, they're in chronic pain all the time and they need all the help that they can get. Of course, sciatic nerve pain and leg pain can be caused from disc bulges, herniations, or ruptures. But usually people have no idea why they get these herniations or ruptures. They just show up, they have an MRI, and it says they have a disc bulge or a herniation or a rupture, and they feel like surgery is their only option. But if you don't correct what caused this in the first place, mechanically within the spine, more than likely you're going to have those symptoms return, even if you have pain, even if you have surgery at that site. Studies show now that if you have a fusion 10 years above and below that, 10 years after that passes, above and below the fusion, you will create more problems than you had previously because the back can't move like it should. You just lose all your normal mechanics in your spine when an area gets fused. So if you can avoid that with natural chiropractic care, of course you would want to. Also, Jim, of course, plantar fasciitis. Several of people come in and that first few steps in the morning are painful. And they need help working out the little muscles and joints in their feet and allowing those to rehabilitate. We have a great program for plantar fasciitis, which really looks at the feet and the entire body and how the feet are affected. So we have great results with treating that too.
Well, real quick, and we got about a minute left. I've noticed this one here, posture decay. Posture decay, I guess, is the older that we get, the more we have a tendency, and especially if you're over a computer all the time, you're leaning.
That's right, Jim. If you go to the grocery store and you observe, you're going to see some people like this, and a lot of them can't stand up, and you know, they're having problems shopping. And we know that the more that you lose your normal posture, the more your quality of life goes down.
Yeah.
And chiropractic care can help you and prevent you from getting to this point, because once you're here, we can't bring you all the way back over here. But at here, we can do a lot of things to change your posture. When you get way over here, you're at risk for a compression fracture and all sorts of things.
Wow. Well, I'll tell you what, any of these things that you're having a problem with, if you'd like to make an appointment, the number is on your screen. Dr. Spencer is located right off of Pass Road in Gulfport, just across from Pass Road Elementary. If you're having some kind of pains in any of those areas, she'll be glad to help you out.